Hi, how are you? Do you know that the solving question is one of the best way to pass the MRCS exam? We will solve all the question of eMRCS, Fawzia sheet and recalls. So here is the question. Let us start the question here. A 45 years old lady undergoes a renal transplant from living related donor. She is well for several months, but on review in the outpatient department is noted to have persistent hypertension and a slight deterioration in renal function. What is the most likely explanation for this? So here we can see at 45 years already undergo renal transplant from living related donor. She was well for several months, so this timing is very important. This time the complication arises after several months. So this timing is on based on the timing, the classification of the graft rejection and their different types are described. So this time is very important. But on a review on the outpatient department, she is noted to have persistent hypertension. This is another important point, and slight deterioration of the renal function. The renal function is impaired. So since these 3 points are very important, several months persistent hypertension and deterioration in renal function. What is the most likely explanation for this? Here the options are renal vein thrombosis, acute rejection, renal artery thrombosis, lymphocyte, and renal artery stenosis. So first of all, let's see the types of graft rejection. Here, the types of graft rejection, they are hyperacute, acute, and chronic. Hyperacute, it occurs immediately during the operation table or within the few hours of the operation. And acute rejection, it occurs within the first 6 months of transplantation. And chronic rejection, it occurs after the 6 months of transplantation. So hyperacute immediately, acute within the 6 month, and chronic after the 6 month. And what are the causes? In hyperacute graft rejection, the causes are due to preform antibodies such as ABO incompatibility or RS, ABO incompatibility and HLA incompatibility. And then acute is occurs due to tissue infiltrate and vascular changes. So this point is one of the important tissue infiltration and vascular changes which occurs in the first 6 months of transplantation. And last of all, chronic, it occurs after the 6 month, and it occurs due to vascular changes. So in acute and chronic rejection, vascular lesion may be occur, and common cause is vascular lesion for acute and chronic rejection of the graft. And in case of acute, there is a tissue infiltrate also. So here we can see another slide here. Renal artery stenosis typically occurs over several months. So this point is very important. The over the several months result in development of hypertension. Renal artery stenosis or renal artery narrowing is usual cause of the hypertension, and it is also a cause of secondary hypertension. In case of renal artery stenosis, secondary hypertension develops. So here after transplantation, if renal artery stenosis occur, then hypertension develop. Most cases can be assessed during using duplex scanning. By the duplex scanning, we can detect it, and it is managed with angioplasty. So here our final answer is renal artery stenosis, because it present after several months. That means within 6 months or after 6 months, and their important cause is vascular changes. So here in this patient, vascular changes occur due to persistent hypertension and blood vessel blood vessels become narrower. In this case, renal artery stenosis is the most common option. And in other case, it may in the renal artery thrombosis, renal artery thrombosis usually occurs suddenly, and if suddenly occurs, then uh, usually hypertension not developed, and acute rejection, it occurs within the 6 month, but here persistent hypertension present. So acute rejection, there are another more cause, so it is not compatible with the acute rejection. Then renal artery thrombosis, it occurs suddenly, so in this case renal artery thrombosis not an option. And lymphocyte, in case of lymphocyte, there is swelling at the graft site and swelling of the ipsilateral leg. So our final answer is renal artery stenosis.